Good morning, everyone. It's another Monday morning, 8 a.m. for my Facebook Live. I am Dr. Mitra, your ophthalmologist in Grass Valley and Roseville in Northern California. Um, I am continuing the video series for questions that my patients regularly ask. And so far, we've been talking about the process that starts with, cataracts. What are they? When are they visually significant? What do we do about them? What are the options? All the way to what to expect when you're in the operating room. What's my patient's feedback as far as, what they notice, how, are they having any discomfort, everything. So we've gotten through that, and one of the more common questions that my patients ask is, how long does this lens last, this artificial lens? So I've already taken out your natural lens that is cloudy, the cataract, and I have already replaced it with an artificial lens. And so a lot of times, what probably instigates this is that in the operating room, the circulating nurse will bring the package of intraocular lens, and they have to read off to double check that this is the correct lens, the correct power, and also there's an expiration date on it. So sometimes patients are like, oh, they hear the expiration date and they have a question: does this need to come out by 2025 or whatnot? So I'm here to tell you that this is not like other implants. So once it goes in your eye, it is going to stay there and it's going to continue working as long as you're alive and your eyeball is intact, that there's no trauma or damage to it. One thing that can happen is that one change that can happen is that you will develop a scar tissue or a film on the bag, the very thin membrane that's holding this artificial lens. And this bag was essentially the same one that was holding your natural lens. And so once we remove the cataract, the bag remains intact and the artificial lens goes into that bag and opens up like a taco, or a soft taco anyway. And so what can happen over time is that a scar tissue develops on this bag. So the lens is fine, the intraocular lens, the artificial lens is fine, but there's a scar tissue that forms on this bag, and essentially it how do you know that it's there? So what happens is you might realize that your vision is not as clear as it used to be. Let's say you've gotten glasses, you're, watching TV, right after cataract surgery, once you got your glasses, you were able to read the writing at the bottom of the TV, and now you begin to see that it's a little fuzzy, not as clear as it used to be. Also, when you're driving, you might notice that even during the daytime, you might be getting some halos or glare, definitely at nighttime. And even reading might be a little bit more difficult with the same prescription that was updated after your surgery. So that's a good time for you to approach your eye caregiver, either your optometrist or your ophthalmologist, whoever you go to, and essentially ask them to check that out. Let them know that something is different and that you know that something is not like it used to be. Something has changed. So once they examine you, as long as the retina is okay, the macula is fine, there's no damage that has happened to the macula, meaning not damage, but macular degeneration or edema or anything like that, and the cornea is intact, really the only thing in between would be that film on the bag that's holding your artificial lens. So what do we do about that? Do we have to take you to the operating room and do the surgery all over again? Actually, no. So far, what's available for removing this PCO, or posterior capsular opacification, or scar tissue, is taking you. It's usually in the surgery center, unless the practice that you're with has that laser in their offices, and a lot of big practices might have that. So the laser is called YAG laser, And essentially, the procedure is scheduled as any other procedure in the surgery center. However, there is no IV sedation or anything like that. But as far as checking in, um, the nurse is taking you to the laser room, putting a sticker above the eye that we're going to be working on, and putting dilating drops in order to dilate the pupil so we can see, your eye surgeon can see the film that's covering the back of the lens. And then what we do is put an extra numbing drop in your eyes, and there's a special lens that goes on your eyeball. Of course, you've had the numbing drop. So it sits right on the cornea with some gel. And what it does is it allows the laser beam to focus on that film or scar tissue and not on the lens that's in front of it. So we're able to make an opening in that film and make sure that it's away from your line of vision. When you're done with this procedure, we definitely recommend that you have a ride, because obviously one eye has been dilated, it's blurred, you've had laser treatment, and so it may take a couple of hours, maybe even 2 to 4 hours for the dilation to go down and for you to feel comfortable driving. So it's best if you have a ride, although just know that there is no, IV sedation on board. And then essentially the first few weeks, you might notice that you have uh, increased floaters. That's normal. But if you're noticing flashes or anything like that, you want to call us and come in. I usually see my patients about a week after the procedure. Um, and I recheck their vision, make sure that their vision is better. I recheck their vision with the glasses that they may have been prescribed after cataract surgery to make sure that's working, and usually that does not tend to change. Mostly the people that notice this changes in vision because of this film prior to doing the laser, people that notice it earlier are those that have had the specialty lenses, like the multifocal lenses, because those lenses are very sensitive to light hitting the eye and being able to see well. So I may do the laser a little bit earlier on those patients because they have more symptoms as compared with patients that go with the standard lens or monofocal lens, because it does not bother them or affect their vision as quickly. So I think those are the main things. I just, ultimately, basically, these lenses that go in your eye, the artificial lenses, there is no expiration date. So as long as your eye is intact, your eyeball is intact, and you're alive, those lenses are continue to work. However, you do want to keep up with your regular eye exams with your eye care provider, whether it's your optometrist or ophthalmologist, and make sure that you let them know if any symptoms come up that don't seem to be exactly right, almost like, different from the time that you had your cataract surgery. So basically, I am going to be picking out different topics as far as our next Facebook Live, unless you come up with some topics that you would like me to discuss with you. So if you want to put your comments and let me know what you'd like me to go over, that would be great. If you are, or a family member is looking for an eye care provider, an ophthalmologist in Northern California, and you would like to see me or have any questions, go ahead and contact my office. You can get on my website and get the contact information. My website is Mitra, MITRAMD.com. You can like my Facebook page. You may already be on there already, and that is Capital I Medical Group. And I'm also on Instagram, so I will be posting this video as a replay on those sites also. That's it. Thank you so much for joining me either live or as a replay. Go ahead and put hashtag replay when you do watch this, and let me know where you're watching it from. I hope you have a great day. I'm going to go back to the clinic. We've had a nice little rainstorm, but I think we might be getting some of the patients coming in anyway. I'll talk to you later. Have a great Monday.